Good.
The West Wing meetings were not aware. I just here.
If I were you, I'd go back to my press conference and go from there.
Hey, Congressman Nunes, was it?
Mr. Speaker, is healthcare back on?
Hey. We're putting the essential health benefits back in. So there were a lot of moderates did not like the fact that the essential health benefits were effectively coming out. So the fact that they're back in, and for a state to ask for a waiver on those, they have to also show where they're going to be improving coverage and reducing cost. Freedom Caucus will like the fact it's a state's option to apply for a waiver to address the essential health benefits, but the moderates like the fact that in the absence of that, they're back in. So that was a big one. Okay. The other one is directing the, at least the proposal now, to direct the stability funds into what you want to call a high-risk offset, which we're confident then the insurance companies would assure the public that will reduce premiums. The complaint was before the American Health Care Act was not definitively reducing premiums in the first 2 years. This will give us that assurance. I think recess makes it harder. We're hearing, I know the administration would like it this week. I've also heard rumblings it may be the week we come back. We are all very happy the discussions are open again.
Right.
I think it was a wake-up call for some who voted no and went home and they maybe did not get a ticker tape parade. It's very important for our conference to move on to tax reform and infrastructure.
Don't have anything that suggests that this legislation will reduce the cost of health insurance premiums in the short term. To the contrary, the latest data I have seen is from the Congressional Budget Office that states that health insurance premiums under Ryan Care over the next 2 to 3 years will go up 15 to 20%. And for us to pass legislation that increases health insurance premiums 15 to 20% over Obamacare, that's not what the people back home want us to do. They want us to lower health insurance premium costs in the short term and long term. I asked the Vice President to consider giving states the power as a matter of right to determine what costly insurance coverages should be required of citizens in their states, as opposed to deferring that power to the federal government, which is the current situation under Obamacare and would be the situation under Ryan Care.